Good day, my name is Alvin S. Adog, BSN1 student of Notre Dame of Tacoron College, College of Nursing. So today we were going to continue our uh, health assessment and physical examination for head to toe. Good morning ma'am, today po is magkakaroon naman po tayo ng assessment sa inyong abdomen, musculoskeletal, neurological, and more. So first procedure is assessing the abdomen. First is inspection. Inspect the abdomen for skin integrity, contour and symmetry. Rationale, unblemished skin, uniform color, flat, rounded, convex or scaphoid, concave. Next is the auscultation. Auscultate the abdomen for vowel sounds. Rationale, audible vowel sounds. Next is the percussion. Percuss the abdomen in four quadrants. Rationale, absence of dull sounds. So, unahin mo natin ang right upper quadrant. Next is palpation. Palpate the liver. Rationale, liver may not be palpable. So now let's proceed now to the genitourinary. First is ask the patient for any problems in the GU tract. Rationale, asking the patient causes the need of for further evaluation and assessment. Ma'am, pwede po ba malaman kung every kayo nag-ihi is masakit po ba ma'am?
Hindi.
Tuloy-tuloy rin po kayo mag-ihi ma'am.
Opo.
Meron po bang masakit sa part ng inyong private area ma'am?
Wala.
Next is inspection and palpation. Inspect and palpate the GU area. Rationale provides accurate data in assessing the GU system. So in this procedure, medyo sensitive. Since Ramadan, I am just going to write NA kasi medyo sensitive yung procedure na to. So let's proceed now to the musculoskeletal. First is the inspection. Inspect the muscle for size. Rationale, equal in size both sides of the body. Ma'am, upo na po tayo dito, ma'am. Next is inspect the inspection of the joints for swelling. Rationale, there should be no swelling. Next is palpation. Palpate the bones on joints for the tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. Rationale, no swelling, no tenderness, and no nodules. So now let's proceed now to the neurological percussion of the bicep reflex. The partners of the elbow is slightly bent and the palm faces downward. Rationale, the contraction of the biceps can be seen and felt. So, in percussion, dapat nakarelax yung mga area kung saan tayo mag-assess ng percussion para mas malinaw ang bouncing ng mga reflexes. Using percussion, um, percussion hammer, ipopercast natin ang patient into 3 times. So dapat ang result ng percussion is dapat nice bounce, which is normal. So just like this. So kapag masyadong malakas yung bouncing or yung tinatawag na hyperreflexive movement is abnormal, just like this. So na yung papercast natin. Kabila naman po mo. So next is the triceps reflex. The partner's elbow is sharply bent. Forearm is placed across the chest wall with the palm turned toward the body. The tricep muscles is struck with the percussion hammer just above the elbow. So rationale, the contraction of the triceps can be seen as the elbow extends. Kalikod ko. So dito sa procedure na to is dapat dapat nakasupport yung kamay ng patient. Kabila po, ma'am.
Ma'am po.
Next is the knee. The patient is sitting position. The patella is struck with the percussion hammer. If patient is lying down, the reflex is tested while the examiner's hands are placed under the knees to bend them. Rationale, the contraction of the quadriceps causes the knee to extend. So to find the point at which you create the your reflex with first is find the tibial tuberosity and on the proximal, and also find the distal patella dito. So in between of the 2 points, that's the area kung saan kayo magpo-percuss ng reflex. So when we do a percussion, we're gonna use swing reflexer to get an average of the patient reflex. So between the two proximal and the distal, dito tayo magpo-percuss sa in between of them. So next is the ankle. The leg is bent at the knee and the foot is supported in a walling position. The Achilles tendon is stuck with the percussion hammer. Rationale, the foot jerks and moves downward. Is galing. So at the ankle, you just need to put your hand on the palm of the foot where you will be able to know if the foot is moving or not. So first thing that you have to do is to find the Achilles tendon dito na area. So which is the area where you are going to percuss area into 3 times. Next is the plantar. The lateral aspect of the sole of the foot is struck with an object. Rationale, the toes bent or curl. So we're just going to place our fingers on the toes to feel if the patient tries to bend or curl her toes. So again, ang normal results nito will be flexion of the big toe or other toes. Next is reposition the client. Rationale, to ensure client's comfort. Ma'am, okay na po ba sa inyo, ma'am, na nakahiga kayo ng ganyan, ma'am? Next is make findings of health assessment and physical examination done on the client. Rationale, these are important data to convey to the physician to aid in diagnosis of the patient. Next is record or document and report any pertinent findings found during assessment to appropriate personnel. Rationale, to provide accurate data in the care of client. And that's it for the assessing the health assessment and physical examination for head to toe. Thank you and have a good day. Bye.